Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Tracy, there is a growing epidemic of cancer of the back of the throat, also called the oropharynx. It's being caused by the human papillomavirus, or HPV.
HPV infection is a viral infection that commonly causes warts. There are more than 100 varieties of human papillomavirus. Most HPV viruses don't cause cancer, but some types of genital HPV can cause cancer in multiple locations, including the cervix, the genital area in both men and women, and in the back of the throat. And here to discuss HPV-related cancer of the throat is Mayo Clinic ear, nose, and throat surgeon, Dr. Eric Moore. Welcome back to the program, Dr. Moore.
Thanks very much for having me on. It's a pleasure.
Dr. Moore, good to have you. Human papillomavirus, I guess causing warts is one thing, but causing cancer quite another.
Right. So we used to see a type of cancer in the head and neck that was a malignant cancer, potentially had a very bad prognosis, but behaved a little bit differently than the typical cancers that we saw from tobacco and alcohol, which are the common, what most people recognize as the most common causes of head and neck cancer. You would see sort of little warty papillary growths around these tumors, and after further testing and eventual studies of these tumors, we found that these were tumors very similar to cervical cancer in women that were caused by human papilloma high-risk viruses, but occurring in the tonsil and back of the throat and the tongue.
Has this changed or increased in incidence in the last 20, 30 years?
It's rapidly growing, so it's the most commonly increasing in incidence cancer in the body. And there's multiple speculations on why that's so. People are not sure if the virus morphed or sexual practices transformed to allow more people to have this in the back of their throat, but it's a commonly still increasing cause of cancer.
And who's at increased risk?
Men and women. There's a bimodal age distribution, so men and women in their 30s to 50s, and then another high incidence in men and women in their 60s to 70s. More common in men, but both men and women.
Who practice unsafe sex? Is that part of it?
It's more common in people with multiple sexual partners. There's more common in people with high-risk sexual behavior, but we often see it in people who don't really fit that mold either.
And you said relatively young age group. And to you, when you look in the throat, it almost looks like warts?
Yes, it has a very characteristic appearance where it'll look abnormal, it's ulcerated, it looks like something that doesn't belong there, but it'll often have a papillary, which is the word most people use to describe warty kind of projections around it.
And do people come in to you because they have a sore throat?
No. They come in because they have spread of the disease to lymph nodes in the neck. So most people don't have a lot of sore throat symptoms, a lot of bleeding until it gets very large or very advanced, but it commonly and quickly spreads to lymph nodes in the neck. So most people come in because they have a lump just below their jawline in the upper neck.
You said the age group is 30 to 50, and then there's younger. What about the HPV vaccine?
So the HPV vaccine is the one surefire way that we think will drop that incidence in the future. There's a long latency period between exposure, infection, chronic infection to cancer, so that might be 2 decades or more of latency period. But the incidence of the viral transmission is also still going up, and the vaccine is very effective in most of the studies at preventing the chronic long-term infection that leads to cancer. Used to be that the vaccine was first only really recommended to young women. It then was expanded to both boys and girls in the adolescent age group, and most recently the vaccine age group has escalated all the way up to 45 years of age, with the knowledge that if you get the vaccine before you've been exposed to the virus, that it will possibly have very long-term preventative effects.
All right, so you said one of the main symptoms that gets people in is that there's a swelling, a lumping in the neck. Any other symptoms that people show up with?
Sometimes chronic sore throat on one side or the other. There's another interesting site predilection. So the tumor doesn't occur in the lips or the oral tongue or the gum line, because that has a very plate-like armored surface that prevents entrance of the virus into that tissue. But there's reticulated or perforated tissue in the tonsil, and there's tonsil on the very back of the tongue deep in the throat. So some people just have this odd sensation of a foreign body feeling, a lump in the throat that just doesn't go away. I recently saw a gentleman who started to develop what we call sort of a muffled or hot potato voice because he had a big lump in the back of his tongue and his throat that he had for a year, but didn't think much of it because he felt otherwise well.
So you said that most people don't come in with a sore throat. They come in with lumps in their neck because the tumor has spread to the lymph nodes in the neck.
Right.
But if someone had this cancer and looked in the mirror carefully, would they be able to see something, or is it something only you can see by
in their
direct
mouth?
exam? Yeah, in their mouth. Could they see it?
Occasionally, some people will get a flashlight and look back at their tonsils, which are in the very back of the throat on the sides of the mouth, and say, oh, one's larger than another. That doesn't look normal. That's not common. Most people just feel something back there but have a hard time seeing it. And the back of the tongue is almost impossible for a person to see themselves. I had one physician that very elaborately got a series of mirrors and looked at the back of his tongue and diagnosed it, but that's not common.
You got to go to the dentist. The dentist looks for it when he does his exam.
And feels for it, which is really important. So a lot of times these tumors are underneath the surface of the skin, so there's not much to look at, but you can feel it like a hard acorn beneath the surface of the skin of the throat. And a lot of times when you go to a dentist and your dentist does a really good oral exam, he'll put a glove on and put his fingers in your mouth and feel the back of the tongue and floor of the mouth, and that's a good way to diagnose it also.
So how do you treat it?
It's surprisingly highly treatable, and this is what's the most exciting thing for us as physicians, is it's a tumor that can cause bad problems, even death left untreated, but is highly susceptible to treatment. There's a lot of immune-related factors to that, so we think the body's immune system is very effective against HPV-related cancers for various reasons. And so if we can get the process started by stimulating a strong immune response, the body can sometimes take over. So we've started to cone down a whole lot of our treatments. Our treatments in head and neck cancer are very heavy-handed. They cause a lot of long-term side effects of scarring and fibrosis and dry mouth and all these things that can bother people for life. And because this tumor is so well treated, we've started to de-escalate or drop off a lot of the severity of our treatment, leading to pretty high cure rates, but then better quality of life long term.
Does that mean that you can usually cure these with surgery alone, or surgery and radiation, and not use chemotherapy?
We try to individualize and use all those tools in our tool bag for the right tumor for the right patient, and this is multidisciplinary treatment. And our multidisciplinary treatment most often starts out with transoral surgical removal. We can remove the tumor through the mouth with minimally invasive instruments that don't leave a lot of long-term side effect or healing problems. So we use transoral robotic surgery to remove the primary tumor and sometimes the lymph nodes in the neck. And then if the patient has ominous prognostic factors like tumor creeping along nerves or spreading outside the capsule of those lymph nodes, we'll then add a limited, very focused and targeted radiotherapy and sometimes a radiosynthesizing chemotherapy drug that's not as toxic as typical chemotherapy. And that treatment de-escalation protocol of using those things sparingly, but all of them, has led to much fewer side effects than laying on a whole lot of one or the other.
And prognosis?
Is excellent. More than 95% of these tumors are cured with early detection and treatment.
We talked about prevention, and the most obvious one and the most important one is the HPV vaccine. But when you're talking about a type of cancer that is spread through sexual contact, getting people to change their sexual habits is maybe a little bit more difficult.
Right.
How can you go about prevention and in that message for people who are listening?
I think just a good, thorough discussion with people, good, thorough discussion with your children, good, thorough discussion with your patients as a pediatrician, having, your eyes wide open and knowing what you're at risk for and how to prevent those infections is a good place to start. And I think the vaccine, although it has stigmata against it of giving a vaccine to a 12-year-old for a sexually transmitted disease, there are problems with that conversation in some groups. It's very effective and very logical to try to prevent something that you may contract without even knowing it.
And you actually have an oropharynx cancer clinic where all you physicians get together as a team to treat these patients.
Yeah, we think that the patient coming in and seeing all these providers up front, everybody collaborating, everybody giving their input is the best way to treat a patient and individualize that care to the patient.
All right, well, there is an epidemic of throat cancer caused by the human papillomavirus. The prognosis, fortunately, is excellent. You said greater than 90% 5-year survival?
That's correct.
With the treatment regimen that you outlined for the particular patient. Because of that, that's led you to de-escalate or do less intense treatment for these patients and still cure the cancer.
Right, right.
All right, even better, I guess, is prevention, the HPV vaccine for young individuals, even up to the age of 45.
That's correct.
Prevention is key. Our thanks, Dr. Eric Moore, ear, nose, and throat surgeon, Mayo Clinic. Thanks so much for being with us.
Thanks for letting us share a message. I appreciate it.